Good afternoon, everybody. My name is Spencer, and I'm pleased to present to you the last session of the day, namely mental health of call takers. When they do their work, emergency call takers can sometimes handle very difficult situations. Therefore, it's very important to provide mental support to the staff of the PSAP, and I have with me some experts on the matter with me who will discuss the best ways to do this. First of all, we start by two psychologists from Romania, namely Iulia Mihaela Filip, I hope I pronounce it somewhat correct, and Andrea Miana Veres. Afterwards, we'll have Niklas Wissen, who is also a licensed clinical psychologist from Sweden. And we have, last but not least, Jennifer White, who is president of NENA from the United States. So, Andrea, the floor is yours.
Hello, everybody. My name is Andrea Veres. I work as a psychologist from 2021 in the Special Telecommunications Service, Romania. And this is my first NENA conference, so I'm very nervous, and thank you for bearing with me. I know everybody is here after 2 long and complex days, and it's probably a better hour for siesta than psychology. I am grateful to be here and to come with mental health message. And I'm very grateful to the really great team that I'm here with. For the last 16 years, until last year, I have been working as a 112 call taker, in the same time working as a psychotherapist in private practice. So in this presentation, my contribution will come from both sides. I'm happy that EENA has a section for well-being. Mental health is a priority. We usually say it should be a priority, but it's not should be, it is a priority, just as much as physical health. So in this note, we will walk you through some of the psychological activities we do with and for the call takers. This is our agenda for this session. So in these 2 days, you have learned a lot about Romanian 112 service, so I will skip the numbers and details and explanations about this. And resuming shortly, our emergency call takers departments have 41 PSAPs, 1 in each county, and approximate 600 emergency call takers. The service is available 24 hours a day, 7 days a week, and the call takers work in 3 shifts. And this is important because later on you will see it on the job demands. Since 2019, the Counseling and Psychological Service Department is designed exclusively for the call takers' mental health, and it has 6 licensed psychologists, and I will talk about this more a little later. So why would a well-trained call taker need psychological support, we might ask? Everybody goes to work from the personal lives, which contain good and bad things, pleasant or unpleasant things. We need to consider that a call taker's job is not just sitting on a chair and taking phones or just rapidly dispatching emergency calls. Emotionally, the call takers face continuous challenges. Some of them are just simple communication difficulties. Among emergency calls made by callers that collaborate, there are people calling in, and they are very confused and scared by the situation they're going through, and sometimes they can barely answer simple questions like, where are you, where is your location, or what is your name? And any call can be, and most of them are, either natural disaster or accident, or situation with wounded or dead people, disease, kidnapping. So this is what a call taker hears in their ears day by day. Crisis in one word, one crisis after another. There are also calls from nervous and irritated people, abusive calls, people who just call to mock or curse the call taker, and because they are being the representative of a state system, and for whom it's mandatory to answer every single call that enters the system. Another challenge, as exposed in our previous presentation, is the aggressive speech towards the call takers, sometimes followed by public shaming of the service and the people who serve it. Also, there are times, like pandemics, that we all talk about, when we had serious overload of emergency calls. Also, there are expectations to perform irreproachably. I think everybody knows that. Separately, none of these are overly traumatic. Call takers manage them day by day just fine, but they accumulate in time. After such times and calls, often rises the spoken or unspoken question, such as what comes next? Will I be able to do this right? Will I be able to manage this next call? One single emergency call can affect someone if it pushes the right buttons, let alone an entire shift of crisis one after another. What is mental health? The World Health Organization defines mental health as the individual's capacity to feel, think, and act in ways to achieve a better quality of life. Mental health includes our emotional, psychological, and social well-being. I think we can all agree on the fact that quality of life is important to everyone. Mental health is about how we think, feel, and act, how we handle stress, how we relate to others and make choices, how we realize our full potential, cope with stresses of life, work productively, or make meaningful contributions in the community. When talking about mental health, we need to also talk about mental challenges and illness. When we talk about health in general, or diseases or illnesses, that means lack of health. In mental health, it's the same thing. Mental challenges or illnesses are about lack or impairment of mental health. Some of the signs are significant changes in routines like eating or sleeping routines, isolation, feelings like numbness, helplessness, being angry, upset, irritated, worried, hopeless, or feeling helpless. There is also increase of drug of choice use, alcohol, food, drugs, smoke, gambling, or whatever people can want to choose as drug. Increase of conflictual behaviors in all areas of life, family, job, friends. Having unexpected pains, that would be psychosomatization. Having persistent thoughts and memories that you can't get out of your head, or hearing voices, or believing things are not true, or doubting yourself. Even thinking of harming yourself or others, and even the inability to perform daily tasks like just simply taking care of your children. Starting with the World Health Organization guidelines, our aim is to improve what we already work on and to continuously develop mental health in our organization with new strategies. Okay. That was a general discussion about mental health. But for call takers, there are special issues, and we can talk about vicarious or secondary trauma, emotional triggers, critical incident stress, survivor's guilt, compassion fatigue, burnout. These are the reasons that we are close to our call takers through our support activities organized on 3 levels: prevention level, primary level, recovery level. Why are we even outlining these things? A strong emotional trigger, for example, for compassion fatigue, can be having a caller verbally abuse you while you take care of his need over the phone, or being confronted with suicide threats while managing an emergency calls, and that happens a lot for emergency call takers. What is secondary trauma? Secondary trauma refers to the natural consequent behavior and emotion that often results from knowing about a traumatizing event experienced by someone else, usually family, friends, colleagues, and the stress resulting from helping or wanting to help them to help actually traumatize or suffering person. The signs of secondary stress are exactly the ones of post-traumatic stress. Vicarious trauma is an occupational challenge for people working and volunteering in fields of victim services, law enforcement, emergency, medical services, fire services, and other allied professions, due to their continuous exposure to victims of trauma and violence. It can lead to a change of worldview and life view, life perceptions, and decrease of empathy, and it can put people and also the organization at risk for a range of negative consequences. In our discussion with our call takers, some of them have shown in the time signs of secondary trauma, insomnia, or just trouble sleeping, dreams or flashbacks from certain calls that they feel they didn't solve it enough or they didn't do enough for the caller, overeating or undereating, sleeping difficulties, anxiety, worries that they didn't do enough. All these were evaluated in screenings, and there have been subclinical scores. Next step for us is implementing an improved screening on secondary trauma. I will just jump back a little to our department, the Counseling and Psychological Services Department activity. Shortly, it has 6 licensed psychologists. 2 of us have previously worked as 112 call takers while studying and working as a psychologist. All the 6 of us have operating licenses on all the required psychological areas: military, organizational, clinical psychology, psychological counseling, and psychotherapy in various schools of psychotherapeutic training. These qualifications are important in order to take care of our caretakers. How do we do that? In terms of psychological activities, we must consider action on 3 terms: short-term, medium-term, and long-term. Short or immediate-term psychological actions are counseling sessions, clinical evaluation and teaching, exercising, relaxation methods. Medium-term psychological actions are psychotherapy, psychoeducation, participating to support groups or self-development program, and as institution psychologists, periodically well-being polls in order to find needs and to develop strategies for better quality of psychological life. Long-term actions, along advocacy for mental health in institutions, we run periodical screenings, organize periodical mental health weeks, courses for resilience, both live and online, actions like the resilient call taker profile and reviewing it periodically, teaching and exercising mindfulness. I would like to run you through an intervention sample shortly. So, as a call taker in the day-to-day job, we can be hooked in many triggers from calls that interfere with personal lives. Women have the privilege to be mothers, to carry a baby for 9 months. And for women who want that process, it's a blessing. I'm taking a women's case because most call takers are women. Among women call takers that had miscarriages or stillborn babies, or simply their children might have died. For a woman call taker that has been through this situation, emergency calls that come from another woman that asks for ambulance to take them to the hospital to make an abortion, as much as they know and acknowledge the women's right and respect that to choose, or there is a case, for example, of a baby born, minutes of life, abandoned in a toilet gas station, found by the janitor, these can be very strong emotional triggers. Even with therapy for grief and loss, after having lived the traumatic event, such calls can still affect the call takers. We usually analyze this affection on 4 levels of processing. Emotionally, they can feel angry or overwhelmed. Physically, they can experience muscle tension or clenching fists or jaws. On a cognitive level, thoughts about the injustice wound: why couldn't those children be mine, for example, or why am I not the lucky mother? I would take care of them. The behavioral impulse can be to yell at the caller, or to be more harsh to the caller, or even to follow the child's trail. We don't usually follow every caller's trail to know what's happening, but the impulse exists. So we deal with what we call emotional dissonance, the way I feel and think, and the way I'm expected to act professionally. A suggested psychological plan would consist in starting with an initial counseling meeting to understand the depth of the problem and to build a strategy. Psychotherapy on personal emotional wound, working on grief and loss, anger management, maybe even family constellations or whatever problem comes up in the discussions. Participating to support groups for women that have experienced miscarriages or stillborn babies. Encouraging the participation to other personal growth programs or workshops, or other related topics. Also, there is community recovery. I'm just giving a short example here. We have a community recovery action that is called Parents of Angels, and it consists in a certain day on a year when parents who have lost their children light up flyer lanterns, and that is a therapeutic action for them. In 2021, our department have conducted a well-being survey among the call takers, having given the job demands for emergency call taking. Some of them cognitive, emotional, and physical demands, work pressure, time pressure, heavy workload, stressful working environment, role ambiguity, emotional labor and poor relations and changes, and being able to serve all these. And given the job resources, meaning of work responsibility, good relationships with the supervisor and colleagues, having a good team to work with, which is very, very important, and having support from the team. If there is an imbalance between these, we will talk about burnout syndrome or workaholism or a lot of other issues. Some of the results for us were a high level of engagement, the feeling of pride to be part of the institution, satisfaction with their work and other activities. A plan has developed that takes into consideration maintaining the good levels of the topics, but also working on the levels that worried us. 23% of call takers experienced medium or high level burnout or medium level of workaholism, stress higher than usual. The plan contains personal counseling sessions, psychotherapy when solicited, psychoeducations, webinars, and workshops on related topics. So everybody knows the slogan, for a healthy life, drink at least 2 liters of water per day. As psychologists, we extend the slogan to make sure you nurture your soul in a healthy way. That can be done by respecting your rest time, feeding in a healthy way, going on trips or vacations, just going out in the air. Different forms of therapy, art therapy, reading, music, listening, gardening, socializing, staying connected to people, sports, and helping others. Why do I say helping others? Contribution, social contribution leads to the feeling of utility, being useful, and that is very important for the quality of life. When working with trauma, whether it's primary or vicarious or secondary, the best results are obtained by working with corporality. So physical movement is one of the most important therapeutic pillars in maintaining positive mental health. I would like to give you a keyword that can be used outside therapy, but it has strong therapeutic effect. It's called encouragement. I have never, in 20 years of psychotherapeutic practice, have met one person who would come to me and say, it was great to be criticized. We don't need psychologists, we need to be raised with criticism. That's a good way of growing up. I don't think it's gonna happen ever. Encouragement is not praise. Also, encouragement does not exclude correcting or improving or constructive discussions about improving things. It's about the process, and it's priceless. In the first break, somebody came to us, and I have no idea if the nice lady is here or not, but I would like to thank her for doing that. She has given us here and now therapeutics, very short session, saying, you do a good work. Romanian team does a good work. We feel that too, and I want to thank you for doing that. That's encouragement. Encouragement has its own language. It's free of use and very simple. It's about appreciating something from the process that you observe the other one does. I like the way you talk to the child over a very difficult emergency call, or I admire the way you updated yourself immediately and get ready for the next call, or dispatching that very difficult call was a good job. These are the words I would use to encourage call takers. And let me just say to every call taker in the world, you do a good job, you do a great job, and thank you. You do make a difference in the world. Some of the testimonials are talking about direct interaction with the psychologists, also about webinars or group actions, and I can see that my time is out. And I want to thank you all for being here. I want to thank you, Marseille, for your warm welcome, and for the organizers for doing a great job for this conference. Thank you.
Thank you, Andrea. Maybe you have time for one quick question? I don't know. Is there any quick question? I have one quick question. It's impressive, the engagement of the psychologists in your country. Is it on a voluntary basis that they come to you, the call takers, or is it scheduled?
You're asking if they ask for psychotherapy or counseling voluntarily?
Yeah, or is it organized by the management that they have to come to you on a regular basis?
Both.
Oh.
Sometimes they feel they need to talk with someone, and thank God they know we're there, and they access us. Or sometimes there are actions that are organized by the institution.
Okay, thank you.
Thank you.
Okay, moving on to our next speaker, Nicholas.
I think I will use this one. Can you hear me? There's a strange echo up on the stage. It's really hard to hear what we're saying. So, yeah, these are my slides. So my name is Nicholas Hussein. I'm also a psychologist. I'm also an army officer. I've been working with the Swedish Armed Forces for basically 15 years in the area of stridsvärde, or combat fitness, or as we translate it, the task-related fitness level. That's what we're working with. And a colleague of mine, for those of you who went to Riga last year, met Magdalena Lind, who talked about mental health and the work that we have done in the Swedish healthcare. And I will come back to that. But what I'm going to talk about today is the use of a structural model to assess this, what we call stridsvärde, or you can refer to it, task-related fitness level. A way to describe it is, sometimes you talk about combat fitness, and I believe I said it as well, but combat fitness is really like a prerequisite. You see, are you ready to go or not? But this task-related fitness level is more dynamic. It's something that changes all the time, or over the day even. And I guess that all of you who has been here sitting and listening all day, that your listening comprehension and focus is probably a little bit lower now than it was in this morning. So in that sense, your stridsvärde has been lowered during the day. At least mine has. So I hope I will keep you focused for at least 15 minutes. So back in 2010, I will give you some background. The Swedish military ship HMS Karlskrona went down to the UNAFOR mission outside of the coast of Somalia in the mission Atalanta. And it was the first time for many years where that vessel actually went out, and its main purpose was actually escorting the UN's World Food Programme ships safely into harbors, and it did so successful. Also, in the first part of the mission, it hosted the UN headquarters, NAVFORCE headquarters aboard the ship. So all of the planned rest and recuperation periods that was supposed to be when it was at bay was actually occupied by other tasks because there was high-level visitors coming on the ship. And after about 4 months in the mission, the commanding officer got reports from all of the branches aboard the ship that our fitness levels or stridsvärdet is declining. We are on such a low level that it's a threat to our operational capacity, and that was a clear signal to the commander to actually address that issue and regain its capacity. In Mali, 2017. I was deployed myself as an operational psychologist, and we used the same structural method. What we saw halfway into the deployment was that there was one group that actually stood out, that were under more load, under more that had lowered their stridsvärde more than any of the other groups, and that was actually the supply group. We didn't have any clue that the supply group was under that kind of stress, but since we used this structured way to measure it, it actually showed up. So what we're actually doing here is that we try to assess on a weekly basis a situation where there is imbalance between the perceived demands of the unit within the organization and the perceived resources within that unit. And when there is an imbalance between those two entities, we perceive it as stressful. It also, if you're familiar with demand resource models, one of the possible outcomes from a negative imbalance is also that the end result will become less than what we expect it to be, and that will reinforce the negative imbalance further. So bringing awareness to such a decline in both of those cases, both in the Bay of Aden and in Mali, actually gave the management or the commanding officers in this case a tool set to actually also communicate to the higher ranks that we are in need of some kind of recovery. We are in need of some kind of resource boost to manage this imbalance. And in an organization such as the military, I don't know if you have experience from it, or it might be even the same in your organizations. It is really hard to get lower level leaders to actually communicate the lack of resources up in the hierarchy, because it's also a sign of failure. You do what you have, you do what you should do with the resources that you have, and if you're not doing it, well, then it's a little bit on you. So this gave them actually the tool set to go past that and communicate these numbers that they're getting. And just as a fun fact, in the later case in the earlier case with the ship, they were actually planning a port phase at Seychelles, and what they did was that they communicated back to Sweden and said, well, we will go outside of this mission for 24 hours and set everybody up with the hotel night. So as it turned out, it was really successful, and I had an opportunity to actually meet the staff on board the ship when they were going home, and we talked about it, and everybody was really, really happy with it. It's easy to say that, well, if you want to solve personal issues and stress issues, just give them some hotel nights in Seychelles. I think it must be really appreciated. But what they actually said was appreciated was that they were actually being acknowledged. They were being seen from their effort was being acknowledged. So they felt that they made some kind of a difference and it was seen. So the model that we incorporated this is the background. It was in 2019 I started to work with Magdalena, who I mentioned spoke here at the event in last year in Riga. We developed this model and the tool set, the structural tool set is a part of it. When we used it in the military, it was analog, paper and pen version. Now suddenly we started to make it digital. So it was a part of this holistic approach that actually gave both the staff and the management valuable information on what is really happening? What is the load that is experienced from the staff? So, what we come up to is that any solution to work stress, to work environment-related stress, is basically not a one-factor solution. It's also always a multi-factor solution because there's so many different factors at play all the time. And we need to address the most relevant. One thing that's really apparent is that it's rarely, and we have been doing this in many places, it's rarely the workload that is actually the main part that causes stress. There's a lot of other factors that makes it harder to endure a high workload. So, and now we'll come to why this is relevant for you. In 2021, we did a test with the Swedish police. They also have this non-emergency number, just a regular number to the police, but they also get a lot of different challenging calls. We heard about, in the session before, about abusive language. We had a situation in Sweden when everybody wanted to make a passport after the pandemic, and because nobody looked at when the expiration date was on the passport. So now during, I think it's February, March, everybody wants to make new passport for the summer, and there are no time slots. The organization is not built for 3 or 4 times the amount of people looking for passport, and so that's when they are the first line, and people are really upset because if I don't get my new passport, I can't go to Marseille, for example. And so this caused a lot of distress. So what we did was that we put this method to evaluate their stridsvärde into this emergency number, and we also. What we do when we measure is that we measure basically 3 parts. I think that's on some of the other slides, but I can go through it now anyway. So we measure 3 parts. We measure this balance between demand and resources. But we also ask them when they're doing their assessment to give a short and a long-term prognosis. In psychology, there's this way called Socratic asking Socratic questions. That's about not so much about the answer, but it's also about making the individual think about the answer, coming up with the answer, and that's a process that gives insight. So when we first ask them to evaluate this balance, it's not just the balance that we get. We also get their heightened awareness of, okay, what are the factors that I perceive? What are the factors that I evaluate? And sometimes when we think about things that we take for granted, we actually tend to see things that we didn't see at the first place. And when we think about the resources, maybe when we think about them, we can identify resources that we actually forgot about or didn't come to think of in the first time. So that's the first part, and then there's prognosis, and then we have what we call negative impact factors, or NIFs. We try to identify those negative impact factors and we categorize them in a couple of areas. And there are conceptuals, that conceptual area where we have like leading systems, infrastructure, rules and regulations, and everything. Then we have the workload, of course. We have psychosocial work environment, and we have, in this case, we added emotionally challenging calls, and there's also a miscellaneous factor and it's a free text for every field, so they can add whatever they think. And we put this in 3 units, and this was quite interesting because this number, 11414, is actually, it's divided in 3 geographical locations. So they have the same structure, the same demands, and the same resources. So if this would be like a scientific study, we would have control for multiple confounders. But they have a different culture. And that shows also that they show up a totally different demand-resource imbalance when we measure them. So what do we do really then? The method, it's not complicated at all. And you could probably set it up with just a pen and paper thing if you know the questions to ask. So once a week we do an assessment, or multiple assessments really. Depending on the structure and the hierarchy of the organization, we provide either the low-level leaders down to the group managers, the task of assessing. When we worked with healthcare, there was such a flat organization. There was like 180 staff, and then there was 4 managers or nurses that managed the whole lot. So we have to pick out some individuals that we call censors that have to do this assessment for their group. So it's a group assessment. And what we get from this is we get a valid current state that is also brings us a history, so we can see if there are trends, if there are changes over time, if it's going upwards and getting better, or if it's going downwards and getting worse. So one might say that, so this is just like one of these pulse meters. You probably heard about it. No, it's not, because we assess with this tool set, we assess the current stridsvärde, and that's not about the individual's stress symptoms or job satisfaction or perceived health. It's more like, as I say, a semi-objective measure. And as I mentioned, we try to get them to think about what is the situation really. So sometimes I think that was Lazarus that has the model. We can either react first emotionally and then think about the situation rationally, or we can aim to act first rationally and then react emotionally, and that's what we're aiming for here. I went through some of these already, and the last picture really is about raising awareness. When we have tried this with these call centers, what we see is that we are actually prompting management action. A lot of the line leaders in the organization say that we have suddenly taken work environment, psychosocial work environment up on the agenda. It's not like this once in a month meeting, or it's an everyday dialogue. So we tend to work as much as we can with stress mitigation, lessening the negative impact factors when we identify them. We also use stress adaptation. Sometimes we can't intervene with the stressors, so we must adapt to it in some way. Adaptation can be a change of mindset, it can be acceptance, it can be a lot of factors, or maybe if we find some stressor that is actually physical in some sense, we can actually build something to manage it. It also relates to resource management. If we have one unit that is really, really low on stridsvärde and others that are really high, we can actually change, make them help each other, or deload the most loaded units. So it's resource management. The lower part here is 2 graphs from 2 of the different units. I think I have a pointer, yeah. So this one is from one of the units, and if I put another one, yes, so you see this red line here, it's on the level of 7. That doesn't say anything to you, but 7 is explained to them and operationalized in a way that says that, well, I'm happy at work. I would recommend my workplace to someone else. I like it when I come there. Some days are better, some days are worse, but overall, I like it at work. So 7 is a good measure. And you can see it's low variability over the time points. This is one rating every week. And then there's also, the middle value is the type value of that week, and then there's a highest and the lowest. So it's pretty much, this is the same workload, the same, everything is the same, as I said. All the confounders are controlled for. And you see, this is much more up and down. And in here we also have a lot of lost ratings in the end. And this is something that for the management, why is this happening? Why are they up and down all the time, and why don't they do what we tell them to do? Because they're identical. So this is not a solution. This is the way to identify when you need to do something. And if we identify needs in an early stage, well, then we can work in preventive manners. So, and also the red line here, it's about 1 score down from the first one, and that stage 6 is described as, well, it's okay at work, but it's not super okay. And if it stays for this, like, for a long time, I'm not sure I want to stay because it's not optimal. And we see that the line goes all over, so it's 6 all the time. So if you have like a dip and 6 for 2 weeks, no problem. But if you have it over time, it's an indication that it's not optimal. It's a negative balance. So I also talked a little bit too long. There's 1 minute left, and that was my last slide. So if you have any questions, feel free to ask them. No questions. Super clear.
We have no more questions. Then I propose we go on. Thank you for your presentation, Nicholas. So for our final speaker today, Jennifer, the floor is yours.
Good afternoon. Thank you for being here. I know it's the last session of the day and we've got an event to go to, so I appreciate you being here and taking the time to recognize the importance of discussing mental health and wellness of our 911 professionals. As a this is still the wrong one. I'll wait on you to fix it. As a 25-year veteran in public safety, being a paramedic in every aspect of a PSAP and call center, 25 years ago we weren't having these discussions and we weren't having professionals work with our 911, 112 professionals and call takers and dispatchers. So the very fact that we are having this discussion proves that there is a commitment and a need to discuss mental health and wellness resources for our professionals. And I think they're still working on it. I'm so sorry. So I'll just go ahead and talk to you about a little bit about NENA and what we're doing in the United States as far as mental health and wellness. So NENA is a standards-based organization. So we develop standards and best practices, policy and advocacy for 911 call takers and dispatchers and 911 professionals across the U.S. and beyond. Oh, there we go. And so one thing that we have done is really realize no matter what work we do, technical and operational standards and best practices, at the very core of our services, we serve our membership. And our membership is our 911 professionals, whether they're call takers or dispatchers or any other part of public safety. And mental health and wellness has been on the forefront for us. And as I said, we're having these conversations and topics because we have to take care of our people, and that's the most important thing that we can do. So we've taken an approach to take care of our own. And how do we do that? My colleagues have talked about how they're implementing programs in their countries and in respective areas to assess needs and how to better serve mental health needs. But what can we do on a local level if you're in a control center or a PSAP? And how do we take care of our own? We hear a lot about resiliency and kind of goes in counterpart with wellness. And so one thing that NENA has recognized is developing a comprehensive stress resilience plan. And these are just some of the components of developing a resiliency plan. Our people are very resilient as far as dealing with emergencies and processing those calls one after the other. But long term, are we building resiliency if we're not taking care of them and telling them how to adjust to that trauma, that cumulative trauma, and those calls that are triggers for them that were mentioned, some of those calls from earlier. So here's some ideas that we have discovered. Having training in stress resilience and what does stress look like? How do they offset that? What are their outlets? Effective use of critical incident stress management. We develop teams and their peer teams of 911 professionals, call takers, dispatchers, public safety, to where, and the peer support also goes along with that, where they are the people that come into different PSAPs, control centers, 911 centers, after a major event, and they're talking to people that are in their same profession that have maybe experienced similar circumstances to where they can understand and give advice on those things. Employee assistance programs, we have those offered a lot of times through our health benefit packages to where, again, they have access to psychologists or counselors if they need to, and at most times that's no charge to the employer or the employee, so it's a great resource. And then working on shift schedules and things like that to gain sleep optimization, that's always difficult for people that are in public safety, as we know. And then just learning the long-time work effects of, again, that cumulative stress, cumulative trauma, being on call all the time at the ready, never having time to kind of decompress between events because you have to be ready to take the next one, and realizing what does that do to a person over time. So de-stress with stress, and this is an easy way to remember some things that help you deal with stress that you can implement easily on a daily basis. Sensible eating, take time to enjoy life, relax, exercise, social support, again, those peer networks or friends, coworkers, even friends outside of the industry that you can rely on, and then gaining a lot of sleep, good sleep. Sensible eating, since I've been here, I think I've eaten better than I do at home because there's no processed food, everything's fresh, and I've not had a lot of sugar stuff, thank goodness. So eating healthy and avoiding those things. We're notorious because of time management, and we're so busy, again, going from one thing to the next, that we're grabbing fast food or something on the go, and that doesn't bode well for us later on. Having healthy snacks in your comm centers or in your control rooms, and making sure that people don't skip meals. Sometimes they get so busy and they just think they're not hungry, and that just does not play well for them overall. Doing things that you enjoying things that are enjoyable to you will soothe the part of your brain that releases stress hormones, so you're not in that constant state of stress all the time. So just enjoying hobbies, whether it's just getting outside for a few minutes in a control center or a PSAP, allowing people to just take a break and go outside and get fresh air. I'm sure we're all going to enjoy that in a little while, and it just refreshes you, even if it's just for a few minutes. Exercise programs. We all know what exercise does for us, walking, running, jogging, whatever your favorite exercise is, but implement some programs and getting the input of the people that are sitting behind the consoles to say, what would you like to see? Are there exercise challenges that you can do within your control center or your PSAP? I had a shift that started a body squat challenge So I walked by the comm center one day and I see these people and they're doing this, and I'm like, what are they doing? And I go in, they said, oh, we're doing 25 an hour. Okay, and so they made it a competition, but it was something that they were able to do exercise while they were at work, and it was good for them. Again, social support can be with your friends or family, those employee assistance programs we talked about, and make sure you're just doing things other than work and not getting any outlets. The pandemic caused us a lot of awareness and a lot of concerns in areas to deal with mental health and wellness, and I'm sure my colleagues can speak to that better than I can. But I also think that we need to realize some of the good things that came out of the pandemic. Sometimes people weren't staying connected with the outside world. Once the lockdowns happened and the shutdowns happened, they made an effort to stay connected with the outside world because they didn't know what was going on. They couldn't just go out whenever they wanted. So they made more of an effort to be connected. Check-ins for yourselves and others. I know for NENA, we started a lot of virtual Zoom happy hours, and they were different times throughout the day to where we could just connect in different groups. We have a women in 911 group, and they would do their happy hour. We have a young professionals that could set up their own happy hour. And then again, you're connecting with people, networking, talking with people that are dealing with the same issues you are. And I think that we will see those continue throughout now that they've become a norm over the last couple of years. I know we're all zoomed out, but some of those things could be actually good for us to continue out of the pandemic. We also became more aware of issues without waiting for the problems. So we'll talk a little bit about what to look for in stress and what to look for in burnout and issues that your employees or professionals may be having. And those all came to light more during the pandemic of watch for this, watch for somebody having these symptoms. NENA has worked with some amazing mental health professionals to develop some different resources that can all be found at nena.org, and I'll show you that slide at the end. But one of those is a post-tragedy care list. This is something that you as leaders can implement in your control centers, in your PSAPs, when there is something major or traumatic that affects your call takers and dispatchers. And it tells you how to address the major events that are that high intensity that could have ramifications for your team members. And it makes sure that you're addressing the needs of the people. When you implement this post-tragedy care checklist, you're going to make sure that leadership is involved and aware of the plan. So at every level, your managers, your supervisors, frontline supervisors, so that they are involved in how to develop this care plan. You don't want to leave anybody's feedback out and how they can help. So bring all of those people to the table, communicate openly. This is our checklist, this is our plan, and how we're going to meet the needs of our people that experience this tragedy. Discuss the event and acknowledge and normalize people's emotion. Make sure that your people understand that there's a plan in place and you're going to make sure that they get the help that they need. This is a big one, again, over the last 25 years that's changed. When I first got into public safety, and some of you may have heard the same comments, if you said a certain call that you took bothered you or made you sad or made you angry, then people that have been there longer than you would say, this person's not going to be a good call taker because they have emotions, or they're not going to be able to process these dispatches because that bothered them and it shouldn't. Well, thankfully, over time, we've realized we're not robots. We are human, and we do amazing things because we do have emotions and we do invest in things and we do care about people. So making sure that people's emotions are acknowledged and that it's okay for them to have them is a huge part of taking care of people after a post-tragic event. Encourage people to talk and express their emotions, to not be afraid to tell you when they've got something going on. Seek relief of duties when needed. If you have a tragic event in your center and you have an employee that just says, I think I need to take a couple of days off because I'm not sure I'm ready to be here, that shouldn't be a negative thing to a leader. That should be a positive thing that you've taught that employee it's a comfortable space for them to express their emotions and concerns. And you should address that and allow them to have that time away from being on duty if they need it. I understand that there's ramifications for long-term, and you have to refer them to different things if necessary. The goal is to get them back to work and get them back to call taking and dispatching. But if you do this in the short term, you're going to retain employees longer, and you're going to retain well employees longer, and their mental health is going to be well. Let them know that their thoughts matter. Don't just ignore it when they tell you something, and let them in on the plan and let them respond to what you're implementing. If you say, I'm implementing, everybody has to get up in an hour, and I want you to go walk around the building, and they say, I appreciate that, but I think I'd rather just stay here, then let them be a part of their own plan on how to take care of them. Make sure your staff knows the signs to look for if somebody's not handling a situation well. And each person's different. So make sure that all of your staff's trained to report those issues, identify those issues, or just acknowledge them with the person so that somebody doesn't slip through the cracks. And then have a mechanism for those signs to be addressed. If a supervisor sees an employee's hateful or seems disgruntled or grumpy to people, have a way for that supervisor to report that to where the employee's not embarrassed by it, but you're able to go and talk to that person and say, what can we do to help you? Or here's what we can do for you. Again, the peer support that we talked about with people that are in the same profession that have experienced similar tragedies, deploy that. Bring them in. They're trained to deal with people going through major tragedy or trauma. Bring them in, and not just one time. In the U.S., we have a tendency within the first 24 or 48 hours of a tragic event, bringing these teams in and letting everybody kind of get out their emotions. But then we fail to do that in the long term. So we need to learn that care is ongoing. And so we need to bring those people back in at different points and do a check-in with our people. As a leader or supervisor, you need to have an open door policy. When you have that open door, you need to be ready for people to come through it. So be ready for people to just walk in randomly during your day and tell you that they're struggling, they're not sleeping, or they're having nightmares, or whatever it may be, and have a plan to direct them to that other assistance, whether it's peer support or an employee assistance program, whatever that may be, or just be ready to listen. Sometimes they don't want you to take action. They want you to just be their vent and let them tell you what's going on because they think it's your care. So just be ready for that. It's okay to not be okay. Again, we are a profession that just doesn't do that well until the last several years. So time is essential. You have to give people time to heal in their own way. I may process a call that is horrific, and it doesn't even affect me because it's, for whatever reason, it didn't trigger me. Whereas the neighboring call taker, it may have triggered them, and they're processing it completely different. You cannot compare people to one another. Everyone does their own healing and their own processing, so give people that time. Come up with some new ideas to implement after the post-tragic event or trauma event. One idea is to start a book library on mental health and wellness. Ask people to pick up a book and just read through it and give you a report back about what was their takeaways, what did they learn from it. This gets your employees talking to one another, and they're able to develop more awareness about mental health and what initiatives are out there. And then they'll bring you back ideas of how you can work on wellness throughout the year before these tragic events pop up. Acknowledge anniversaries. This is a big one too, because a lot of times if there's been a huge traumatic event, our idea as leaderships is to get people through that event and then sweep it under the rug and not bring it up again so that you don't bring up those emotions. We need to normalize those emotions and that it's okay. Don't pretend it didn't happen. If you're a leader and you've got employees or call takers or dispatchers that went through an event, try to put notes in your phone or to alert you that there is an anniversary coming up. Write a handwritten letter to those people and tell them, hey, I've not forgotten what you went through, and I've not forgotten how far you've come to overcome it, and I appreciate you. And that will go a long way. Again, we're running out of time, but I just wanted to mention that the NENA Wellness Continuum, this is a continuum that we've developed that is a holistic approach to mental health and wellness for all of our 911 professionals, and it can be found at that website there. We've also developed a standard to protect the well-being of 911 professionals, so you can go to that standard and find some more information about ideas for you to develop into your own agencies, and then read some of those. And then the peer support development, so that you can develop that in your own agency or a region and share that as a resource. So I would encourage you to go look at all of those things and see what you can find there that might help you along in your journey. Any questions?
No more questions? Okay, thank you very much for your presentation. Jennifer, that's good. So it leaves me by saying that this is the end of day 2. The conference will begin tomorrow at 9 o'clock with a session in the plenary room, vertical indoor location, and in track 2, emergency communications handling around the world. And just for those who are registered for the social event this evening, and they have to present themselves at 1900 hours in Fort Gantoom for a memorable and funny evening co-powered by EENA and Everbridge. I have to remind you that there is no transportation being arranged. So if you need more details, you have to look in the program booklet. Thank you very much and have a nice evening.